As a result, David became confused about how to manage his condition and lost trust in the healthcare system. This lack of coordination can have real consequences. Inconsistent guidance can lead to poor self-management, medication errors, and reduced adherence to treatment plans. The issue also reflects role confusion within the team, where boundaries and scopes of practice weren't clearly defined or respected. Without consistent messaging and mutual understanding between disciplines, patients like David are left to piece together their own care, which can be overwhelming and unsafe.
One major issue in David's care was the conflicting advice he received from different health professionals. For example, the dietitian told him that frozen meals were acceptable, while his GP said that they weren't. Likewise, his GP advised him to take pain medication before food, but the pharmacist told him to take it with food. These inconsistencies left David feeling frustrated and unsure who to believe. This situation highlights a breakdown in interprofessional communication and collaboration. Each provider was working within their own discipline rather than aligning their advice to support a shared care plan.
An example where David's interprofessional team had poor communication is when the information that David received about his diet was not consistent between healthcare professionals. For example, his GP said that frozen meals are not acceptable while his dietitian says that they're okay. This could be both overwhelming and confusing for David, as it makes him unsure what decisions he should make for his health.
An area where David's interprofessional team functioned poorly was when he received an overwhelming amount of information from different disciplines all at once. David was told how he should be eating and exercising right, as well as various other factors that he should be altering to live out a healthy lifestyle. While this is important information to share with the patient, this can quickly become quite distressing and confusing, as it is too much information that the patient feels that they are expected to implement immediately.
Another thing I would like to expand on from David's interview is what contributed to or detracted from patient-centered care. David's social worker told him that his occupational therapist would visit the next day, but the therapist never arrived. He also mentioned the burden that he has to schedule every appointment all by himself without any help. This example highlighted a lack of communication and coordination between interprofession, which compromises effective care.
Another thing that overwhelmed the patient and added to his stress was that he felt that he had to repeat his details over and over again with multiple health professionals. He was already a private person and was hesitant to share his details even once. For example, with the psychologist, he had expected that they had a background on him, but that was not the case, and he had to repeat and relive all the traumatic and saddening events that he had experienced during his treatment.
Perfect. One key issue our team identified was unacknowledged overlapping care plans. This can lead to duplicated interventions, gaps in accountability, and client confusion. To address this, we recommend introducing a centralized care coordination process. This could include shared documentation systems, clear role delineation, and regular structured case conferencing at key points of care. This allows professionals to clarify their roles, align recommendations, and present David with a clear, unified plan.
Another key issue was fragmented communication between team members. To improve this, we recommend implementing structured handover protocols and a single communication platform where all updates and changes are documented in real time. This ensures everyone has consistent, accurate information, improving client outcomes and reducing error. Reducing repetition for the client supports coordinated care and fosters his sense of independence. By integrating shared systems and structured communication processes, we can create a more coordinated, safe, and efficient team approach.